Welcome back to Open Med School. Today I'll be discussing about pharmacokinetics. It's one of the pillars of pharmacology. What is pharmacokinetics? Let us think. Suppose you are taking a tablet. What is happening to the tablet? The tablet gets absorbed. It reaches the liver, gets metabolized as the first pass metabolism, enters the circulation, goes to various tissues, it acts on the cells via receptors, ion channels, etc. The part of this, that is absorption, distribution in the body, metabolism and excretion. The drug is excreted mainly via the kidneys. Some may be excreted through the liver, the bile, the sweat, breath, etc. This is the pharmacokinetics, easily remembered by mnemonic ADME. That is standing for absorption, distribution, metabolism and excretion. So pharmacokinetics is what the body does to drug. Body does to the drug. Whereas pharmacodynamics is what the drug do to the body. So that is a fundamental difference between pharmacokinetics and pharmacodynamics. Hope it is clear to you. Why the pharmacokinetics is important? It is important because you can choose the best route of a drug. For example, diazepam. Oral diazepam is better than intramuscular diazepam. So intramuscular should not be given. You can predict suppose a drug is given, you can predict the onset of the action, the peak action, the duration of action. So that is the one of the advantage, or by remembering this you can predict the onset of the onset, duration and intensity of the action of the drug. So you can adjust the dosage in special situations so that you can reduce the toxicity also. So that is the importance of learning about the pharmacokinetics. So regarding absorption is the movement of drug from site of administration to systemic circulation. So absorption means from the site it enters the systemic circulation. So what do you mean by absorption? It's not only the oral absorption, oral drug given. Absorption is the movement of a drug, from the site of administration, to circulation. So it can be the intramuscular, intravenous, oral, rectal, all these. So the key influencing factors, what are the factors that influence the absorption? One, the route of administration, whether it is oral, intramuscular, intravenous, subcutaneous, inhalation, transdermal, all these very important factor. Suppose we are giving orally, the pH is important, the gastric pH is important. The gastric emptying, because the oral drug You have to remember the pH, emptying time of the GIT, drug formulation also. For example, entry-coated tablet. So the formulation of drug is also important. IV administration drug has got no absorption step because it directly enters the circulation. So now we think about what is meant by the bioavailability. Bioavailability. What is bioavailability? It is the fraction of drug that reaches the systemic circulation. If fraction of the drug that reaches the systemic circulation is called bioavailability. So what is the bioavailability of IV drug administration? Can you say? It is 100% because it is directly reaching the circulation. Whereas oral drugs, it is less than 100%. Obviously, because of the, I have already mentioned about the stomach, the pH of the stomach, the emptying time of the stomach, the digestive enzymes, all act. And of course, the very important thing, the drug is reaching the liver and it undergoes metabolism called, that is for the first pass metabolism. First pass metabolism mainly occurs in the liver and some amount in the gut wall also. So remember this, the first pass metabolism occurs in the liver to a major extent and also in the gut wall. Hope this point is clear. So we take two scenarios. One is IV morphine, second is oral morphine. So IV morphine and another patient is given oral morphine. Which has what higher bioavailability? Of course, it is 100% IV morphine. Now we go to the distribution. It's a very important topic. The distribution, what is the definition of distribution? So we have already mentioned the pharmacokinetics is absorption, distribution, metabolism and elimination. So what is distribution? By definition, it is a movement of the drug. It is the movement of drug throughout the body. Movement of the drug throughout body, in the tissues and body fluids. So distribution by definition is movement of drug throughout the body tissues and fluids. So what are the factors that are affecting? One is the lipid solubility of the drug, the molecular size, the protein binding, very important point, protein binding, the hydration status of the patient, hydration, and the body composition, that is fat versus muscle. For example, in some of the drugs in males and females, it has got a different action because the fat content, some of the lipid, so the solubility, etc. we already mentioned. Now we think about the distribution of the drug. Already mentioned. One terminology you should remember, is the volume of distribution. Is mentioned as VD, volume of distribution. VD is the amount of drug in body, that is concentration of drug in the body divided by plasma concentration. So VD is amount of drug in body by the plasma concentration. That is the volume of distribution. Imagine you are adding a dye to a bucket of water. So think this is a bucket of water. The more the amount of fluid in the bucket, lower the concentration. So that if you are adding more amount of water into the bucket, naturally the concentration less. Low volume distribution. Low volume distribution. When will it occur? The particles are large particles, highly charged particles, protein bound. That is why I already mentioned that the distribution of the drug depends upon the size of the particle, the charge of the particle, whether it's a protein bound also. So which are the drugs which are the volume distribution is high? Small particles, lipophilic drugs. So in lipophilic drugs, what happens? It enters the fat. From there, it is again released. So regarding distribution, you should know the volume of distribution. Volume of distribution is the amount of drug in body divided by plasma concentration. High volume of distribution, the efficacy, the concentration drug will be low. Just remember the example of the bucket filled with a large quantity of fluid. Now we'll think about the protein binding. Drugs may be bound to various proteins. Higher the bound, suppose the drug is there and if it is bound to proteins, what happens? The free drug will be less. So the drug can be protein bound and part is free drug. The drug that is acting on the cell is the free drugs. So that is a key point that you remember. So let us take a clinical scenario. Patient has got chronic kidney disease. So one of the features of chronic kidney disease is they have hypoalbuminemia. Albumin level is less. So what happens to a drug like diazepam, which is highly protein bound? It is protein bound. There will be more of free diazepam is increased because the albumin is less. So this leads on to toxicity. Hope it is clear to you. Now we go to the next part, the metabolism of drug. That is the M. What is metabolism? It is a conversion of drugs into metabolites. That is the mainly inactive. Most often it forms inactive. What are the major sites of this metabolism? First and foremost is this liver. Then the gut wall, kidneys, some drugs are renally, kidneys, some the lungs, of course skin, and some in plasma. So the major site is liver, the gut wall, kidney, lungs, skin, and plasma also play a major role. There are two phases usually. One is the phase 1. It is usually by cytochrome CYP 450 oxidation. So drugs can be phase 1 by other cytochrome CYP 450 oxidation. Phase 2 is conjugation. UGT forms water soluble compounds. So these are the two ways. For example, codeine is converted to morphine, which is an active metabolite. Usually conversion is into inactive, but some drugs like codeine, they are act as a prodrug. It converted to morphine. It becomes more active. So that's one point to remember. Now we go to the final part, excretion. What is excretion? Excretion is elimination of drug. Elimination. Again, the most important is elimination via the kidneys. Then the lungs, skin, and through the bile, that is through the reaches intestine and passes through the intestine and feces. So a drug has to be cleared from the body. That is the clearance. Clearance is elimination rate divided by plasma concentration. This determines how fast a drug leaves the body. So elimination or the clearance determines the rate at which a drug is cleared from the body. Why the clinician should need it? This is for calculating the maintenance dose. So clearance is important to calculate the maintenance dose. Here you should remember one term, the T half or the half-life or the T length. So what is T half? It is a time for plasma concentration to drop by 50%. The plasma concentration to fall by 50%. That is the T half. So T half is There are formulas to calculate the T half. For example, morphine, the T half is 2 hours. So morphine, the T half is equal to 2 hours. When will 97% or almost all the drug is eliminated? Approximately 5 half times. 5 half-lives. So what will be 2 into 5 is equal to 10 hours. So 97% of morphine will be excreted. So the last part, something called the drug kinetics. There is 2 ways the elimination is there. One is called the zero order kinetics. Other is the first order kinetics. Zero order and the first order kinetics. Zero order is a constant amount of drug is excreted independent of the concentration. Constant amount independent of the concentration. Classical example is one is phenytoin, second is ethanol. So remember 2 examples: zero order kinetics, phenytoin and ethanol. First order kinetics means a constant fraction. Constant fraction is excreted. Most drugs follow first order, and it will have predictable half-life. So details will be, and in such condition a steady state will be reached after 4 to 5 half-lives. If you are administering the dose, continuous dosing. So after 4 to 5 half-lives on continuous administration, steady state is achieved. So that is the importance of remembering this. So we have discussed today the pharmacokinetics, the mnemonics, ADME, and the importance is for selecting the correct route, calculating the dose, dosing interval, avoiding toxicity, especially in patients with renal and hepatic disease, about which we will discuss in much detail. Adjusting the dosage for children, obese, and in the next session we will discuss few case-based questions based on the pharmacokinetics. So remember, pharmacokinetics is what happens to the drug in the body: absorption, distribution, metabolism and elimination. Stay tuned. Thank you.